Welcome back, everyone. I'm very pleased to introduce our final session of the day on social behaviour and policy. My name's Katie Adam. I'm a research fellow at the University of Edinburgh. And this is a subject fairly close to my heart. I work between the vet school and the social and political science faculty as well. So I've definitely heard snippets from the earlier sessions about the value and the importance of an interdisciplinary approach. I think that's what this network is all about, and of working closely between clinical, biological and social sciences for both pandemic preparedness and effective response. We're in quite a unique position at the moment in that we've seen a pandemic up close and personal. It's not theoretical. It's not really something that you can study in a laboratory. So taking this opportunity to understand social behaviour and policy and what it looks like in a pandemic situation is hugely important. And also to learn from that in terms of preparing for, much as I hate to say it, the next pandemic. So that really is what this session is about, both learning and preparedness. And we have speakers presenting on both academic research spanning at least 3 continents, possibly more, and also speaking about policy engagement, so more of that science policy interface and an advisory role for government. As you can see, we're doing this session a little bit differently. We're planning to end with a panel discussion. So after each presentation, if anyone has any specific questions for that speaker, then there'll be a few moments for that. But if you have more general sort of comments or thoughts or queries that you'd like to bring up for this panel discussion at the end, then please hang on to them, write them down if necessary. And without further ado, I would like to introduce our first speaker. So Professor Alemka Markotic is a professor at the medical school at the University of Rijeka and the Catholic University of Zagreb in Croatia. She's also director of the University Hospital for Infectious Diseases in Zagreb. And she's going to talk today about social behaviour and policy preparedness for the SARS-CoV-2 pandemic.
Okay, good afternoon. Thank you very much for the kind introduction and the invitation for this very interesting symposium. And I have to say I'm infectious diseases doctor and researcher. I'm not a specialist or a professional in social behavior, although I had to deal it on a daily basis with the patients, and I did a lot of efforts to deal with that during the pandemic. So we all know in this room that the infectious diseases are actually diseases which changed the world during the whole history. And what is actually the challenge? Because they're invisible enemy. We cannot see them, but we can really feel them. So we had, as I already said, a lot of strong lessons during the history, even the recent history in the last 100 years about the emerging pathogens, and not very same, but there are a lot of similarities with the last pandemic 100 years ago. It was a Spanish flu in 1918, which killed actually more than 50 million of people. And when we compare that with the First World War, which killed about 10 million and 2 million died of hunger related to the war, we can see that only almost in 1 year, viruses killed 6 times more people than whole World War I and the hunger. And of course, at that time, we didn't have antibiotics, not to treat the viruses, but of course to treat the concomitant infection, which we mentioned today as well. So we really know what now, and we learned, we repeated the lesson, what is the power of viruses, and COVID really showed us it. What was another lesson which we can learn from the history, but also from the recent pandemic of COVID-19, is that Mother Nature, as the biggest bioterrorist, created a lot of different emerging infectious diseases, but with the help of irresponsible humans and their behavior manners, it could be a dance of two, and then we can phase that it is dance of death very often. So what are the key points which are very important for the policy for the COVID-19, but also many other emerging infectious diseases? I certainly did not list all of them, but some most important, which we actually face during our daily work, I put it here. So it is very important to have and to plan human and facility infrastructure, education and training, protection of the healthcare workers, diagnostic tools, capacity. It's very important to have enough capacity for intensive care units. Also, I would add, and we probably do not emphasize enough intra-hospital infections, which probably killed more people in ICU than directly COVID-19. Then therapeutics and vaccines, of course. And what is also important is to think about the health status of the nation. So what about the human and facility infrastructure? We face a lot of problems during the COVID time, and many of the hospitals probably have had some already prepared isolation units, but no one in the world was prepared for such a huge number of patients in one time. So we should have a possibility for improvisation and flexibility to increase the capacity. What I would like to say, because I'm from Croatia, is that the Croatia and Dubrovnik is the first place which actually created quarantine on July 27, 3077, and here we have a long-term tradition of dealing with infectious diseases and also strong influence of public health measures, although sometimes during the COVID-19 I thought that we forget all of it, especially in the general population. This is more romantic view for that quarantine today. So what we had in many different places, as well as in Croatia, we had some capacities for isolation unit, and at least in such kind of units, we had trained people and everything ready. We thought that we had everything ready, and we really think at the beginning of the pandemic that we're ready and we will put all the patients at our hospital for infectious diseases, which is also the National Referral Center for Infectious Diseases. However, we very soon face a shortage of places, and we need to improvise and, of course, arrange different possibilities where to put at least people at the outpatient clinics or daily hospitals should be organized with additional infrastructure and try to be able to handle the patients 24 hours for 7 days and all the time. We're doing that on a daily basis. Infectious diseases hospital is open all the time, but anyway, we haven't faced so many people in previous history. Another important thing which we all are aware is education and training, and of course we know that it is important to have knowledge and skills, but it is very important in such kind of situation where there is a panic and there is something new and threat, that we have self-confidence and that we, at least among the healthcare workers, do not have panic. To avoid that, we actually, at the beginning of the 2020, just immediately when we saw the situation in China, organized a symposium with the Croatian Society for Biosafety and Biosecurity and our clinic, and also Croatian Academy of Science and Arts in 2 big halls, and at the same time we had YouTube internet presentation, and a huge number of healthcare workers actually were introduced in the knowledge which we had at that time about coronaviruses. What I think was very important, and probably something like that happened in many other countries, and it is very important to have that education at the beginning, something which can be epidemic or pandemic, especially with new diseases. Also, it is important in infectious diseases hospitals, but also in many, in other general hospitals or clinical centers to have sustainable training, how to accept and how to make different measures with the patients with severe dangerous pathogens, contagious pathogens. So this is one practice during the Ebola time. We're practicing we will admit the Ebola patients at our hospital. Also, it is important not to introduce and educate sustainability only clinicians, but also laboratory workers, which we already saw how important is and complex is diagnostics. Misha also talked about that. So we had different trainings, and this one was with American CDC and Association of Public Health Laboratories for the Southeast Europe. So, and all the time, actually on a regular basis annually or several times, we repeated, information about how to deal with the PPE. What we actually learned during the COVID pandemic is that actually it's too late to teach the people at the faculties, at the medical faculty, about the infectious diseases and all that threats. So we decided to introduce the lessons in the primary and secondary schools, and we got the support. During the pandemic, we got the support from the Ministry of Science and Education, and we introduced different lessons. We gave education first to the teachers, and then they transmitted to the kids, and kids were very interested to do it. They organized small groups, even small research groups. They did small research, and at the end of the year, at the end of the spring, they presented their research on a national basis and got rewards. So it is now, we organized that for the third time, and I think it is very important to introduce such education very early in the schools. Also, we faced that it is very important to have enough stockpiles of the PPE and also to be developed to be able to develop different other protection measures. We faced the recent huge Ebola epidemic, and so that many, almost more than 500 healthcare workers died, and in 2020, there was some information that more than 7,000 of healthcare workers died from COVID-19, and the final numbers we will never know. Well, we like to think that we invented everything in a modern life, in the modern world, but if you look at those two pictures, then I have a question for you: who did better? This guy didn't know anything. It was 17th century, and he didn't know anything about the microorganisms. Probably officially nothing about the real protection measures, but he had everything instead of gloves. He had even a stick about 1.5 meters for the physical distance. So, well, yeah, we learn a lot. We have a lot of possibilities, but still it seems that sometimes we are at the same level like in history. So another important thing for the protection and important policy for the protection of healthcare workers are vaccines and vaccination, of course, for the general population as well. And I can say that in our hospital, we were very happy that we had more than 85% people vaccinated. However, it is still too low for the infectious diseases hospital if it is lower than 100%. How to explain other people that they should be vaccinated if we cannot convince 100% of people who are dealing with the deadly disease on a daily basis that they will not be vaccinated, and then they're listening to some other people or some misinformation, which we can discuss later. So we've heard a lot about the importance of diagnostic and diagnostic tools. And we, of course, should have a facility. It is very important, especially for the dangerous pathogens. And we have it as well in Croatia. And what was very important at the beginning of this pandemic was that in a very short period of time, it was established the first PCR test for the detection of COVID-19, which gave us an important tool to restrict the infection and spread the infection in the general population and, of course, in the healthcare system. Besides the PCR, which was gold standard, it was also very important to develop antigen tests or point of care tests, which give you at least some orientation in a short period of time, which is very important when you have a shortage of places to hospitalize the patients and should decide how you will deal with the patient who is in your outpatient clinic. Of course, we saw in Misha's presentation that multiplex diagnostic help us in addition to distinguish different, for example, respiratory diseases in this situation. But besides the technology, you have to have the people on the first place who are skilled and in possibility to create, and especially at the very beginning, tests. So this is our expert, Ivan Christian Kurold, who actually 7 days after the first test was introduced in Germany, created the in-house test in Croatia, and we were ready like months before we had the first case. And the first case we had on February 25th. It was a big deal. Our president of the government, together with 4 of us who were at the civil headquarters dealing with the pandemic, announced that we at least have finally our case. We still was not aware what will be after that. And it was really a challenging situation with the full refrigerators of the samples. And at the beginning, my small research group involved from a long time for the detection and research of dangerous pathogens. But then very often we realized that we need more young people to work whole day, 24 hours per day. And also that we, of course, need huge platforms, COBAS platform, to be able at least at our hospital to detect on a daily basis about 1,000 samples. And we very soon, and even Christian introduced in whole Croatia diagnostic spots in many different medical places to be able to handle it. We try to keep our steps with the science still. We isolate in March virus, which is very important, not only for the big centers to isolate the virus, but also for the smaller centers to be able to do some and to be able to connect for the research with the bigger centers. Well, what we really still have to be aware in in the policy of management of different pandemics is that we can have some additional situations, bad situations like we had in Croatia, and that was 2 times we had during at the beginning of the COVID time, a bad earthquake. So we also needed help from even military to help us to actually manage the patients in a few days before we really checked everything. What is very important for the future pandemics is to have enough capacity of intensive care unit. Not only the beds, not only the ventilators, but also enough educated people. And also the people who are not working in ICU on a daily basis, the whole bunch of healthcare professionals should be should be trained to be able to be involved in work in ICU during such kind of pandemics. It was really challenging, and it was really tough for the people who worked there. What is also very important, and especially very connected with intensive care units, especially in such kind of disasters, is very difficult to control the intra-hospital infections. When you're dealing with the normal situation, we all know that we still have a problem in intensive care units, especially with the intra-hospital infections. But in such situation, it is a lot of improvisation with the people and the infrastructure. It is very difficult to deal with that. And I think that intra-hospital infections killed in intensive care units more people than COVID directly. So we have that examples from Ebola, from COVID-19, and it is important, of course, to deal with that in the future and to find a way how to avoid that. Another important thing in the policy of fight and prevention with dangerous pathogens and pandemics is, of course, development therapeutics and vaccines. And whole world, and especially the Europe, has really from the very beginning very clear strategy that we need to develop as soon as possible effective therapeutics and vaccines, and that we need to accelerate all that steps. So it was really tough. I was in possibility to be a member of the COVID-19 therapeutic subgroup at the EU level. And it was really interesting, but also a tough situation that you need to review almost all therapeutics which you have in the world and to decide about the 10 possible, which then people will put additional efforts to develop them, to establish additional clinical trials and everything. And we gave like 7-8 instructions and recommendations to the EU Commission how to do it on a proper and fast way. What is very important also to think during the peaceful time is how to handle the health status of the nation. So how to handle the chronic diseases, the habits, the behavior, the environment, healthcare availability. And in Croatia, we had a lot of problems with that. So we are cooking, we have good food, good wine, we are a tourist country, like to enjoy the life. So when there is drinking, we drink, when there is food, we eat, but when there is work, many of them don't bother themselves. So unfortunately, yes, we are very often champions in the soccer, but unfortunately, we found that we were actually champions in many other not so good things. We are in, so how we entered the pandemics, and probably many other nations should do such kind of analysis, is that in 2019, we were among the oldest nations in Europe. And of course, we were the first with the percentage of people who had high blood pressure, hypertension. Then another bad thing is the mortality from diabetes mellitus. We were the first in Europe. And then overweight population, because we like to eat. Among the female and males, yeah, we were the first. And guess what? All those things are the most risky factors for the severity of disease and mortality. So this is kind of answer why we had higher mortality from COVID than we expected, actually. And it is important in the future, not only in Croatia, but also in the whole world, that we think about, because it is not COVID-19 only infectious disease which killed people with chronic diseases, but almost all infectious diseases, especially severe, have all that chronic diseases as a risk factors. So in this part, in the conclusions shortly, we need really in the future to think strongly about the human, but also facility infrastructure, and to spread it, and to actually have written and very smart explanation how to increase the capacity in such situation. Education and training, I recommend that we start very early in the primary school. we need to be aware that in such kind of situation, we cannot deal whether the China or someone else will send us protection PPE, or we will produce it on time and have a good stockpiles on time. Diagnostic tools, it's very important to increase the capacity and that it will be flexible. I already said what I think about the capacity of intensive care units. And of course, it is important to introduce a lot of money and efforts to develop new therapeutics and vaccines for infectious diseases, not only in this situation. And of course, health status of the nation should be also taken in consideration. And then at the end, I will just target some issues about the behavior and social sciences. As I said, I'm not the expert, but I was introduced as a member of the headquarters who really needed to manage the whole outbreak, the whole pandemic in Croatia, to manage the hospital, and also to communicate with the public and with the media almost whole day. We had at the beginning probably 3 times a day newspaper conference, and then at the evening we needed to participate in different news on the TV, and also deal with the public, which was very difficult. And at the beginning we were heroes, as you probably know, and then at the end almost all and everybody accused us for everything. I can say that I was among the most trusted people during the time, but anyway, I really faced a lot of difficult situation in communication and in the behavior with the people. But also to remember it was not happened to us because we have internet platforms and all that stuff which make us trouble to us. But let's see, Science magazine 100 years ago said about Spanish flu pandemic that people do not appreciate the risks they run. It goes against human nature for people to shut themselves up in rigid isolation as a means of protecting others. And people often unconsciously act as a continuing danger to themselves and others. Do you recognize that? Yes, we did it. We repeated that. Of course, yeah, it's difficult during the Valentine time to obey all the rules. And it is difficult in nowadays times because we have all that Facebook doctors, Google doctors, and all of them who knows everything about everything. Political parties, they also use the kids, the religious, our famous singer realized that he will earn more money if he is on the side of people who are against the vaccination than on the side of people who would like to be vaccinated, than some people at the sport. And this is our president of the Croatian Medical Chamber Association. He needed to react on the words which our president said, that COVID-19 is not a big deal, it's like tooth decay. So yeah, well, it's not Trump. The Trump is not only smart guy and smart president. So that was really a lot of challenge at the political level, especially, for example, in Croatia during the COVID time, we had governmental and presidential election, and that was really challenge to fight with all that misinformation which the opposition used to do because to fight with the government and the people who already have idea how to deal with that. So there are a lot of direction, but I will not read it now because we will discuss it here. What was actually at the end very scary and interesting for me is the situation and the behavior among the scientists, and I would like to discuss it here if we will have time. Actually, we had, and I will use Croatia again as an example, and I discussed that with other people and the similar situation other countries had. So we had very famous scientists in Croatia, but also abroad from Croatia, and they're very big experts in their own field, like signaling, like oncology, like whatever. But they find idea that they have to be in media every day and talk about COVID-19, and not from the perspective of their expertise, so that they can probably help in developing of therapeutics or diagnostics, or to be able maybe to give some ideas how to develop some vaccines. But they started to talk about epidemiological measures, which actually they did not know anything about, especially from the practical way of thinking, and also about the treatment of the patients. And they have never treated any patients except maybe few mice. So that was really a challenge to fight with them, because it was a huge amount of narcissism which they showed. What was actually at the end, we were lucky that actually general population realized that they're scientists of general practice, and they returned to the real experts and tried to ignore such kind of scientists. So it was really surprising for me how people among the scientists also are ready to be involved in some things in very dangerous situation about they don't know almost anything. So at the end, the take-home message from my presentation is that we have to have a policies, all that rules and directions, and be prepared, but never think that you're ready. So thank you very much from my research group and from my hospital.